Good morning, Dr. David Blyweiss talking to you for a few minutes on IV therapy, nutritional IV therapy. Many years ago, people would have to go into a hospital setting to get nutritional IV therapy. Now we can do it in an outpatient setting in the clinic, in a very comfortable room with very comfortable chairs, with nurses giving your IVs to you. People want to know, why do they need an IV nutritional therapy? For many people, you can't get as much of the nutrients that you need if you are deficient orally, whether you don't have enough digestive enzymes, whether the stomach is a barrier to actually getting enough in. Vitamin C is a great example. When you get more than perhaps 3,500 milligrams at one time, you will get something called bowel tolerance, which is another name for diarrhea. We can, in an IV, put 25,000 milligrams, 50,000 milligrams of vitamin C in for people to utilize right at the cellular level. We bypass the GI tract. And we do the same thing with other nutrients, whether it's iron or zinc, magnesium, calcium, that people actually need. Most people are coming in now after their first IV when they feel themselves coming down with a cold or the flu, or maybe they're fatigued, or they've come back from a trip and they've been dehydrated at 30,000 feet for 6 hours, and they come in and after an IV or two they just feel wonderful again. In fact, most people who come in for one classically will remember how good they felt and will come in again if they have the first signs of a cold or the flu, in order to get rid of it either markedly sooner or not get it at all. Another side of this is that there are so many heavy metals that we have in our system that the FDA has indeed approved certain chelating agents, chelating meaning we're getting rid of heavy metals from you, in an IV. If done appropriately, if you are trained to do it, there are no downsides. We can get rid of the most common levels of heavy metals in our bodies, and those are lead and mercury, cadmium, arsenic, even aluminum. These are a series of IVs that we give to people, and every 4 times that we chelate you, we will intersperse that with a nutrient IV to replace the minerals and other metals that we are taking out blindly with a chelating agent. So many of the chronic degenerative diseases that we see today, including hypertension, some cardiovascular diseases, by chelating people, we can get rid of the heavy metals. And although we have not yet shown that the chelation indeed is getting rid of calcium plaquing, it may be that the decreased load of heavy metals that we are getting out with an intravenous chelation therapy is what is causing the improvement in someone's hypertension or their coronary vascular disease. An aside here, I had a coronary calcium score done which showed pretty high. I began IV EDTA chelation twice a week, and my radiologist, who did another calcium score, called me up and said he's never seen a calcium score go down. What was I doing? I tried to explain to him what we're doing. He didn't quite understand it, but he said, well, just continue what you're doing. It seems to be working. The IV treatments are benign, they're safe, they're effective, and there's really no impediment for people to get them. Minimal reasons why one would not be taking IV EDTA chelation therapy or DMSA chelation therapy. These are all chelators, and classically those are due to kidney functioning. What we find is if you do it appropriately, you do it slowly, kidney functioning also gets better. So if you have issues that you want to discuss that may include treatment with IV nutritional therapies, you should give us a call. We're at 561-886-0974, and this is Dr. Blyweiss saying goodbye.